Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby, and today I'm here with Zaneb Yaseen, and she is a board-certified orthopedic surgeon in Central Georgia, and today we're going to talk about her practice and the patients she treats for sports medicine. Dr. Yaseen, thanks so much for being with me.
Thanks for having me.
Would you let our audience know a little bit about your background as an orthopedic surgeon, but the additional training you did for sports medicine?
So I did residency in the University of Rochester in Rochester, New York, and then after completing that, I did a year fellowship in Pittsburgh at the University of Pittsburgh in sports medicine.
In the sports medicine fellowship, in addition to learning about additional injuries and things that you might see that are sports related, how do you interact with where those injuries are coming from? So is there a part of your fellowship that also works with athletic training and sort of what leads to those injuries?
Yes, absolutely. Part of the training is working with the sideline team physicians as well as the athletic trainers. We get to know them really well. We cover the training room where the athletes can come in with their lumps and bumps throughout training or at the games. It's one of the most rewarding parts of the job. As
that part of the sports medicine as being really sports related, hands-on sports related, do you also contribute to the training regimen as well as the injury prevention and sort of the diagnosis side?
A little bit. It's definitely a collaboration because the athletic trainers are essentially the frontline people. They're there all the time. They see how they're doing, and they do a lot of the care with the athletes for sure. They definitely kind of follow our guidelines, so to speak, but I mean, they're really smart, well-trained people, so it's like a partnership.
When it comes to sports medicine specifically, what kinds of patients, and I know there are lots of different kinds, but what are you primarily seeing? Injury related or something that you've had an injury and then you end up with a medical problem about it? Is it acute injury, or I got hurt years ago and now I'm coming in with what was a sports injury?
So I like to have my practice broad. So I like to see both, actually. So sometimes it's before an actual injury happens and you start to get some mild tendonitis or inflammation. Sometimes it's just simple that when you're a kid. Sometimes it's the acute injury and we treat it appropriately. And then sometimes it's the, I hurt myself several years ago, now I'm having these kinds of issues, and then you get to kind of follow someone along throughout their life to see what happens. But it's a little bit of all of them, but all of them are rewarding in a different way.
When does a person know, your weekend warrior, when do they know that they should probably see a doctor? About how much pain and discomfort should someone take before they call Ortho Georgia?
So I tell people if it's interfering in your activities, if it's causing you to not walk normally or not sleep normally, if it's making you grumpy, if you're taking anti-inflammatories a lot more often than normal, I would say you should get seen. Sometimes it's something really easy, but the concept of going to the doctor is sometimes scary, to be told something is wrong with you. But if you're not able to do what you want to do, it's impacting your life, if you're unhappy, those are reasons to do something about it.
So let's switch gears to the intervention or the treatment side. So once we're in the office with you and we've had an injury, what are some of the ways that you go through your diagnosis with either diagnostics or medical intervention, maybe even before we get to surgery?
So I always take a good history, kind of find out who the person is, how they hurt themselves, what makes them happy, what keeps them active. Then we talk about how it happened or whatever. We use x-rays to visualize. We kind of talk about what mechanisms cause it. I start generally with non-operative treatment. Most of the things can get better with physical therapy. Now if it's somebody who had an acute injury and cannot move their knee or something like that, I often escalate it to get an MRI to make sure I'm not missing something else. Sometimes we have an ultrasound that we use in the practice, and I have some training in that, so sometimes I can use an ultrasound to look at some simple tendon ligament issues. But that's kind of generally how we start. And depending on how severe it is or how high my level of concern is, we either go more aggressive and get further imaging versus try the routine anti-inflammatories, ice or heat, rest, and physical therapy.
Where is the role for the orthopedic surgeon in following a current and present athlete as they return to the sport? Say you take care of a pitcher's arm or shoulder, are you then involved with them as they return to their performance in the sport, or is that something that is managed by athletic trainers and in a different way?
No, we're involved. I like to know where they stand. I don't want anybody to get hurt. I want people to do well. So like I said, it's a collaboration. So we work well with the trainers, but we try to talk to each other. I give them my phone numbers to say if there's any issues or concerns. I always have the parents call too if they have any issues. But I like to see them, especially before they get back to activities. I like to know if they're struggling at all, if they're really okay, or if they're posturing to guard themselves, things like that. I don't want someone to get hurt if they don't have to.
Tell me a little bit about some of the work that you do specifically in the shoulder, maybe some of the injuries or conditions you treat, and then maybe some of the ways that you do that.
So I love the shoulder. So I'll see pretty much anything. Of course, trauma, fractures, but I'll see instability of the shoulder, so the person whose shoulder dislocates. So often we treat that conservatively or surgically. It's one of my favorite surgeries. I see rotator cuff tears, which can happen from falls or chronic injuries or something along those lines. And then I progress even to arthritis. So I take care of older people or all ages that have shoulder arthritis, and if we have to, we get to the talk about replacements and things like that. I'd like people to be as functional as long as possible.
Can you tell us a little bit about what scoping a joint or arthroscopy entails, so that people who are watching understand what that actually is?
So it's wonderful. It's a minimally invasive type of surgery. Instead of making a large incision and going through a lot more tissue and leaving more scar behind, you can use a camera that's about the size of a pencil to go into the joint. You make smaller incisions. It looks a little bit neater. But I feel like you can see more of what's inside the joint. You can move the camera around, you fill it with fluid, with water, so that it's not hurting the joint. But for instance, in the shoulder, you can see under the rotator cuff, and then you can go above the rotator cuff, and you can see all around the socket. And it's a very great tool, and you can take pictures, and so you can show people the pictures. I try to show them what their anatomy looks like. It's pretty fascinating to me. Some of the people like it, some of them could go without, but
when you're scoping the shoulder and you talk about filling it with fluid, is there already laxity in the shoulder enough to allow it to be scoped, or is it going through any of the structure other than the incision?
So typically there's enough laxity unless you have something like frozen shoulder or something. So you're not really forcing something that doesn't have some give.
And then scoping also maybe in the hip or in other joints?
Similar. Hip's a much bigger joint. It's a more involved surgery than a shoulder or a knee. And we go through more muscle planes. So there are different conversations I have with those kinds of patients. But once it gets in, you can see the beautiful hip joint, and you can see the labrum and do a lot of the things that you need to do. It's a little bit more technically challenging than a knee scope and a shoulder scope, but it has really good visualization as well.
In that procedure, there's the observation that you want to do of what's going on. Are you also doing an intervention?
Yes, we try to fix whatever, if there's a labrum issue or a rotator cuff issue or something, yes.
When it comes to talking to your patients before they get to you, but then once they've gotten to you, what do you tell them about protecting themselves to prevent injuries or even wear and tear and the way that our joints eventually wear out? What would you tell them?
I have like a spiel. So I tell people that it's very important to, even if you don't feel that you are an athlete, if you're going to go forth and do some sort of exercise or aggressive activity, pretend. Make sure you train beforehand and prehab, stretch, do all the right things, make sure your muscles are ready and things like that. Then do your activity or train or play your sport or whatever, and then make sure you recover, cooling down, warm, stretching again, things like that. It's important to take care of yourself. And learning that when you're young sets you up for when you're older, and you hurt when you do little things. So it's important because our muscle groups get weaker in some and stronger in others. Certain ligaments and tendons get tighter when you get older. So keeping a diligent routine and repetitive routine will put you in better shape when you're old.
And protect you from injury.
Yeah, and protect you from injury.
When it comes to having chosen to be an orthopedic surgeon, what was it that attracted you to medicine and to orthopedics specifically, and to sports then?
So I, even at a young age, knew I wanted to be a surgeon of some sort. But I loved math and physics, and I studied engineering when I was younger, electrical and biomedical. In medical school, which I'm very grateful to have been in medical school, I rotated with some orthopedic people, and they had like tools and all these things, and it just struck me, it was amazing. And so I knew that I had to do that. That's the kind of surgeon I wanted to be, and I got lucky and I got into a really great program. And then during all the, fracture care is amazing, joint replacement's amazing, everything, most of the things that we do is stunning. But I enjoy the arthroscopy portion, I like covering the games. So while I loved a lot of orthopedics, I just kind of gravitated more, and I had very good mentors that kind of made me want to be like them. And so sports was one of the things. I could see all ages, I could do all kinds of surgeries, it was meant to be.
Are you also a sports aficionado, or did you play sports in college? Was it something that you had also done in your personal life?
Not in college, but I played lots of soccer, and I would always go attend games and things like that. But you know, I enjoy, my husband is a big Bills fan, and we were in Rochester and we would go the Bills games, and then I actually ended up loving sports again when I covered the games. I did a lot of hockey, and I've covered all levels of hockey, and we covered football up to D1 football, which was great, and gymnasts and all kinds of stuff. So like, and I did like being in the locker room and hanging out on the sidelines with the people. So it's kind of like, I kind of love them all, so to speak.
Yeah, well, as you just joined the practice earlier in 2020, we welcome you to Central Georgia.
Thank you.
And thank you for being on the show.
No problem.
Thank you. And thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Yaseen and her practice, please visit us at atriumhealthnavicent.org.